Thank you, Chair. So recently we reached a tragic milestone of 20,000 Londoners losing their lives to COVID-19 over the pandemic period. These are not just figures, but they're real lives lost and real families affected all across London and even more across the whole country. In the 7 days to the 11th of May 2022, there were 81 deaths recorded in London within 28 days of a positive test. This level of COVID-19 mortality has remained the same since about February 2022. On testing, on free testing, the Labour administration in Wales has taken a more pragmatic approach and extended free tests to the end of June 2022. We're hearing a lot about living with COVID-19, but how can we live with COVID-19 if we don't know who's got it?
Yeah, and the concern is, thank you for raising that, the concern is that it's only the well-off can afford to live with COVID-19. Those that aren't well off can't. And actually, within different boroughs of London, there are different rates. They vary in relation to different boroughs. And the concern is those boroughs where there tends to be greater deprivation and where people are less likely to be able to afford to, with the limited monies they've got, made worse by the cost of living crisis, pay for a test rather than and then find out if they've got the symptoms rather than the alternatives. I'll give you an example. In the London Borough of Enfield, the rates are 58.5 per 100,000, whereas in Hillingdon, it's 115.9 per 100,000. That's almost double from one borough to another, and that's why it is a concern. The reason why the Welsh Government extended till June the free test was because they wanted to make sure the numbers are properly down before the testing regime came down, and there is a concern. If you're well off, you can go to a local pharmacist and buy these tests. If you're not, you're taking a risk in relation to whether you've got flu-like symptoms, it could be flu, or whether you've got COVID-19. And the point is you could be passing this on to somebody whose immunity is suppressed, and they could have tragic consequences. That's why we did lobby the government for the free testing to continue unsuccessfully.
Thank you, Mayor. And moving from testing to vaccinations, less than half of eligible Londoners have received their booster jabs. How are you continuing to work with London's NHS and central government to ensure that communities are not left behind in the vaccination programme?
Yeah, thank you for your question. So I raised this in my most recent meeting with NHS leaders, and in fact my health advisor raised this to me yesterday. So the huge amount of work that we did over the last couple of years, and you'll know from your experience in Brent, particularly going out towards those communities that were hesitant to ask them to do their first vaccine, then the second one, but then there was the Evergreen offer, which is nobody's left behind, has been successful. Each week there are many people who receive their first dose. We are keen to make sure those who are eligible, as I said in my original answer, to their fourth injection ostensibly, the two vaccinations, the booster and now the other one, are receiving them. GPs are following these up, as indeed are NHS Direct. I know anecdotally, people I know above the age of 75 have received their invitations. It's really important that we raise awareness of this, the spring booster, but also we go back to those who may have missed out altogether to remind them it's never too late to receive your first vaccination. Any help members of the Assembly can give, bearing in mind your links in the community, is much appreciated by not just the NHS, but I'm sure by all of us.
Thank you, Mr. Mayor, and I thank you for visiting the Brent Central Mosque in Willesden Green, where they had a real vaccination drive and made sure that people attending Friday prayers could also get vaccinated. So thank you. No further questions.
Thank you, Assembly Member.